conduct a hearing on protecting employees and employers in the public H1N1 and sick leave policies. I'd like to welcome everyone this morning on a very important topic. We're meeting today in the midst of a global pandemic. The H1N1 virus is sweeping our country, closing hundreds of schools, idling thousands of workers, and infecting many millions of Americans. The H1N1 flu virus is now officially widespread in at least 48 states, and the President has designated the virus a public health emergency. The Centers on Disease Control report that the flu spread is very unusual this early in the season, and deaths among children and young adults are higher than expected. The CDC estimates that 22 million Americans have already become ill, and at least in the last 6 months with H1N1, and 3,900 have died. The recent study predicted that 63% of Americans will be infected by the virus by the end of December. Fortunately, public health officials did have an early warning this spring of the potential of a widespread outbreak. The Obama administration and public health officials took immediate steps to develop policies to slow the spread of H1N1 flu and minimize the disruptions. But all of the planning and preparations cannot fully address the uncertainty surrounding a new highly contagious virus. While I applaud the quick identification and development of a vaccine, the delays of producing and delivering the vaccine to target the populations have concerned millions of Americans. I am encouraged by the reports that private vaccine manufacturers have worked out the production issues, and we seem to be back on track to getting the needed vaccine to the American people. The H1N1 vaccine is a new vital tactic to slow the infection rate. While we fix the supply issues, the public health officials emphasize that there are additional ways to slow the spread of this dangerous virus. The CDC has issued guidance on recognizes the role employers and workers play in slowing the spread of the disease. According to the CDC, an individual who comes to work with the H1N1 will infect about 10% of his or her co-workers. They recommend that any worker with the influenza-type illness to stay home, and that employers should allow workers to stay home without fear of any reprisals and without fear of losing their jobs. But the recommendation is easier made than followed, because for more than 50 million workers without paid sick leave, taking a day off from work means a pay cut or worse. Workers fear that they will be punished for taking time off, either by losing pay because they do not have paid sick days, or even fired. Employees in the food service, hospitality industry, school, and health care fields are among those who cannot afford to stay home when they're sick. Because these employees have direct contact with the public, the consequences of coming to work sick are not only damaging their health, but could damage the public health as well. Let's face one simple fact. When you're struggling to make ends meet, you're going to do everything possible not to miss a day's pay. The lack of paid sick leave encourages workers who may have H1N1 to hide their symptoms and come to work sick, spreading the infection to coworkers, customers, and the public. It's not good for our nation's public health or for businesses. The National Partnership of Women and Families found that sick employees who go to work cost the economy about $180 billion in lost productivity. This is a significant loss in productivity for American economy compared to the minimal cost of providing a few paid sick days a year. The Bureau of Labor Statistics says the cost of paid leave borne by employers for lower wage workers only accounts for 4.2% of their total compensation. Despite these minimal costs, current federal law does not mandate that employers provide paid sick leave to their workers. This is why members of Congress have been pushing for universal paid leave policies that will ensure workers at all income levels be able to take advantage of paid leave policies. I strongly support these efforts. However, the current H1N1 pandemic demanded an emergency response. 2 weeks ago, Congressman Woolsey and I introduced temporary and emergency legislation to help workers and employers deal with the spread of the H1N1 flu virus. The Emergency Influenza Containment Act will guarantee sick workers 5 days of paid leave if their employer directs or advises them to stay home. This temporary legislation will slow the advance of H1N1 being spread through the workplace and encourage open communications between employees and their employers on sick leave policies. This emergency measure will not and should not supplant the need for comprehensive paid family leave policies, but I believe there will be a circuit breaker needed to get this virus under control while protecting workers, employers, and the public. I will continue to work with other members, such as Congresswoman Rosa DeLauro, and their efforts to win permanent reform in this area. But I'd like to thank the witnesses for joining us today on this important hearing, and look forward to all of your testimony.